Hi, I'm Mike McAvoy, EMS editor for Fire Engineering Magazine, with today's roll call tip. Probably not a common occurrence, but something that you may see perhaps in the summertime when somebody's spilling chlorine that they use in a swimming pool, or mixing chemicals in a home where chlorine gas is formed and overwhelms people's respiratory system. Somebody who's been irritated in their nasal and throat passages by chlorine is a very difficult patient to manage because their coughing is incessant, their difficulty breathing very difficult to control, and yet we carry a very simple antidote to that chlorine, which is extremely acidic to the respiratory tract. And that antidote that we carry is sodium bicarb. So the recommendation, if you were to look in toxicology manuals, and really what happens at the emergency department when you bring a person who has been exposed to chlorine and has irritation to their upper airway, is to make a nebulization of bicarb. In our ambulances and medic vehicles, we carry sodium bicarb that's 8.4%. That's a typical concentration that you'd see if you took out one of your 50 ml bicarb syringes. So using a nebulizer, you would take 3 cc's of the conventional sodium bicarb, 8.4%. You would dilute that with an additional 2 cc's of normal saline, and that gives you a concentration of total 5 cc's, 5% sodium bicarb. Nebulizing that, giving it to a person in a mask or by having them breathe into a traditional nebulizer, will ease the symptoms and reverse some of the acidic damage and irritation that's happened in the respiratory tract from chlorine inhalation. So a simple antidote, very effective tool that you could use if you had somebody exposed to chlorine who has a lot of respiratory irritation. So 3 cc's of bicarb from a bicarb syringe, 2 cc's of sodium chloride, makes a 5 ml mixture of what we want, which is 5% sodium bicarb. Nebulized for a patient, can be repeated as often as necessary in order to have a person's respiratory tract irritation relieved. Probably something that you will find, and if you don't find, the hazmat folks can help you get into your local protocols. I'm Mike McAvoy. Be smart out there.